Hello, my name is Norma Stives. I am the director at Life Choices Women's Center, located in Altamont Springs, Florida. We are a pregnancy resource center offering free services, education, and material goods to those who find themselves in unplanned pregnancies. We are very happy to empower women and men with knowledge that may not only help keep them healthy, but may also even help save their lives. At Life Choices Women's Center, we believe knowledge is power. That's why we have decided to share these 3-part videos so you can be empowered with life-saving information for you and those you love. The 3 doctors presenting these videos are passionate about saving lives and helping people be healthy. Happy learning.
All right, STDs, it's not a great topic for dinner, so they put me at the end. And I don't have any slides, so you're really fortunate, aren't you? It's great. But there's some interesting things you need to know about what's happening with sexually transmitted diseases. First of all, I need you to know about what Planned Parenthood does with STDs. Okay, so when they came down to Kissimmee, one of my heroes down there, Marianne O'Shea, she goes to Holy Redeemer with me. You all know Marianne? Is she here? Okay, Marianne's great. She's a beautiful woman with a beautiful voice, by the way. And she was able to counsel one woman who had just come out of Planned Parenthood, and she'd gone in actually for the STD screening, and the lady came out in tears because they were going to charge $600 for her to get worked up for sexually transmitted disease. $600. At the health department, it's free. I mean, $10 maybe. At my office, it's a lot like. So it's an illusion, as we all know, that Planned Parenthood is providing any women's health care that is of any meaningful value. We know when they say they're doing mammograms, they're not. When they say they're doing STD screening, they're making profit off it. That's obscene. That's obscene. So that's one reason we're fighting against them. Let's talk about some of the common diseases that are out there and what's happening right now. I always talk about the 4-H club, the viral STDs. It's the 4-H club you don't want your child to belong to, all right? You know, HBV, hepatitis B, hepatitis C, HIV, and then herpes simplex, and I'll lump the 2 hepatitis together, and the 4th one is HPV. And there's a discussion of all this in the book, The Hidden Truth. But what you need to know about all these diseases, number 1 is HIV, the incidence of HIV. What do you all think? Do you think the incidence per year, the number of new cases of HIV since it was first discovered? My first patients at George Washington, my very first patient was a former clergyman who, you know, I got everything all over me. I took care of him. We didn't even know what he had. It was AIDS in the 80s. Do you think the incidence has gone up or down or stayed the same since 1980s? Yeah, essentially, the incidence has not changed. It's 50,000 new cases every year of HIV. Despite all the education that's out there, we still get 50,000 new cases. Now, the deaths from AIDS have gone down because of all the drugs. So something's wrong there. With herpes, we're still at the same statistics, and you're going to see a video afterwards that's not going to allude to this, so I'm not going to spend any time on that. And hepatitis B, hepatitis C, you can do blood tests for all of those. The one you can't do a blood test for is HPV, human papillomavirus. And I spent a third of my book, started out talking about HPV. HPV is most likely the most prevalent of the viral sexually transmitted diseases. It is the cause of cervical cancer. So if you don't know this already, cervical cancer is a sexually transmitted disease. And I can't say that enough. So all y'all who are going out there and getting pap smears, who've been married for 30 years, you have the right and the obligation to tell your doctor, hey, I'm not at any risk of this disease. And that's true also of your sons and daughters. I want to share with you, I never read from the book, but I was reviewing it here, and I forgot what I'd written, actually, so it's pretty good stuff. You know, this book, I say that because it took me 20 years, and Kathleen will vouch for that. She's from Montana, and I would go out to Baker, Montana every summer on our family vacation. I'd sprawl out my father-in-law's table with all the papers. I'd bring 2 briefcases, and I'd write, and I'd write, and I'd read, and I'd read, and with a lot of help from God, we got it done. And it's just a way of me expressing my righteous anger. So read, this is an article from a Dr. Mary Fussell about the Speculum Exam in women. And I'm not going to get in a lot of details here, except to let you know that prior to the 1800s, the art of examining the woman was left to midwives, who used their hands and not their eyes to perform the exam in a practice then known as touching, a true art. The midwives, they were bonding with the women and understanding what the woman was going through. Then, in the 1830s, Parisian doctors used the speculum to examine prostitutes for venereal diseases so that they could be sure that these women were not transmitting the infection to men. How many of you have seen Les Miserables or read the book? You know, the beginning, that's a terrible scene in the beginning. So the British would also employ the speculum to make sure that the women were free from venereal diseases. So then, in the 1850s in England, they tried to introduce the speculum exam into routine practice, but the colleagues protested immediately that the examination with the speculum was degrading and immoral. Quoting from the British Medical Journal, they stated, "The female who has been subjected to such treatment is not the same person in delicacy and purity that she was before." An argument that you can make today when you have physicians who are performing these exams on virginal women, which I see all the time. And I mentioned the Napoleonic Wars and the fact that women were subjected to these exams. If women refused to have this exam, the onus was on her to prove that she was a virtuous woman who did not consort with men for pleasure or for pay. You could really make a valid argument, I would make the argument hands down, that not a lot has changed in medicine. One of my chapters in the book is the presumption of promiscuity. We are treating our teenage daughters and now our sons as potential prostitutes, or whatever word you want to choose. And it is happening because ACOG, American College of OBGYN, the American Academy of Pediatrics, and the American Medical Association have caved in to the culture of death and caved in to all of this internet obsession and television and media obsession with transgender and LGBTQV, XYZ lifestyles. You've all seen about the 30 different types of gender. This is confusing us, and it's making our medical students, well, they're intimidated. Frankly, they're intimidated. Now, you heard earlier, I'm on the faculty, I think still, of UCF School of Medicine. Any of you have any interactions with UCF School of Medicine? They have a great dean who is Catholic, Dr. Deb German. Wonderful woman. Came from Vanderbilt. I know her well. And they gave me an award for being one of the best physicians when it came to implementing Obamacare in my practice. So you're looking at a guy who's kind of schizophrenic here. I'm doing all kinds of things that don't make sense because in order to survive in private practice nowadays, I have to do all this crazy stuff. And my wife will tell you that. But the medical students, the first three that came to me, one was a Jewish young man, the other one was a Hindu, and the third one was a Coptic Christian. All men, all gentlemen, and they were fantastic. We loved it. They came, they saw me deliver a baby, one of the last babies I had an opportunity to deliver, and we had a great experience. The fourth student that came was a young woman, and the first thing she did, she's going to meet the patients as a first-year medical student. She took out her sexual history that they're telling her that she has to take on all the patients. And by the way, taking a sexual history is something that I'm graded on by Cigna, by everybody. And in the sexual history that they are supposed to obtain, I won't even get into the details, but suffice it to say, you're meeting the patient for the first time and you're asking, "Mr. Smith, how many sexual partners have you had? How many," well, I won't get into details, but it's amazingly insensitive and this bad doctoring to start asking people about the stuff that she was prepared to ask. So she instead was seeing how I handle patients. And so when women came in that had been on the pill and their lives were ruined, destroyed the way you've just heard, or they were considering abortion, I would counsel them. She went back to UCF Medical School and she dropped out of the rotation. A first-year medical student getting a family medicine rotation, dropped out, went back to the school, and wrote a scathing review that since then I haven't had a single medical student come. And that's been 4 years ago. All right, so that's the kind of stuff that we're up against. With the abortion pill reversal, I wanted to share this with John, because I just got this text today from Debbie, in California. Debbie Braden, she's a nurse practitioner. We all get these calls about women who had had the abortion pills, and I'm up now closer to Gainesville, so I get quite a few that come from there. And I did get a text just like 3 days ago from a woman who said, thanked me, my baby's healthy, and it's a wonderful thing to get out of nowhere. But she said to me today, 2 of the very few doctors in the state of New York have had to drop out of the abortion pill reversal network due to administrative restrictions and reprisals from their hospitals. Prayers from you and from us that these hospital administrations consider the value of offering abortion pill reversal over fears that they'll have medical legal ramifications for their careers. All right? Now, Cleta Hartman, who's John's right-hand woman there, his wife for many years, wrote a book several years ago, edited a book called Physicians Healed. Have any of you seen it or heard about it? If you haven't, I encourage you all to go to onemoresoul.com and get it, because it's the stories of doctors who have had their careers, in some cases, almost destroyed by this. So I'm going to close by I mentioned the 4-H Club and the bacteria. Now I'm going to talk about the bacteria. I need you to know this. The bacterial infections, STDs, syphilis, the rate of syphilis has doubled in the last 3 years in the state of Florida. It's up to what is that? 15 per 100,000, 1,500 per 100,000 population. It's doubled. And when we got the memo from the Department of Health, it came with a little explanation. It said this is largely attributed to the increasing incidence of MSM, men who have sex with men, as they refer to it, and bisexual lifestyles. Okay. But there's no mention in there of counseling people about this. Chlamydia has gone up dramatically in young women. It's another bacterial STD. All right. The only good news is gonorrhea has gone down, but all the other ones have taken off. HPV we talked about. I want to let you know a large part of the book is about Gardasil. I predicted in my book that I mentioned all the bad things about Gardasil. 50 million American boys and girls starting ages of 10, 11, 12 have received this. And now they had to come out with a new Gardasil because they realized that the 2 of the 13 high risk was not enough. They only protected against 2 of the 13 that cause cancer. So they come out now this year with Gardasil 9, and they expect these 12-year-old girls who are now 17, who've never been sexually active in their lives, who will never get cervical cancer if they're just careful, if they don't have multiple partners, if they don't take birth control pills, if they don't smoke. They want them to get another round of shots. And I have several articles that I won't get into detail about the side effects from HPV vaccine. You go to Japan's literature, Denmark, Australia, and this country, all over the world, there's women who are developing neurological diseases, permanent infertility. This is not an exaggeration. They're not common. When you have 50 million people, it's clearly not a large number. But if it's your 12-year-old who suddenly develops new-onset epilepsy a week after getting an HPV vaccine, which is reported in literature, you're a little upset. She's never been sexually active. Okay, I want to close by reminding you that, well, first of all, thank you for mentioning St. Monica. I was going to do that as well. St. Gianna, and of course, St. Augustine. We have so many people out there who've led the way for us. If you all don't know the story of St. Gianna, the pediatrician in Italy, we need to be mindful of their presence actively in our lives as we minister to these folks. We want to ask them to pray for us. I want to advise you not to bury your talents. There are many heroes in this room, and I wish everyone who does ultrasounds on these women in this pregnancy center could get up and share the stories. Mary Ann and Ginger and others, the stories, I see them, and thank you for the work you do. Thank you for the privilege of being your medical director, and please give money to this great organization. And in closing, if you come up, just leave money on the table here, checks to John Littell, and I'm going to give half of everything to this, whatever you can donate for the book. I want you all to have this book. God bless you, and thank you for your time.